grim news for Canada's biggest city and the Peel region just to the north of it, moving back into lockdown. Here's what that means. I'll give you some of the takeaways. Number one, it means there will be no more in-store shopping at retail locations. It will have to go back now to either curbside pickup, where that's possible, or online. Sales only. Grocery stores, pharmacies will be kept open as well. Big box stores will be kept open, but places like gyms will be closed. There's also more limitations coming for places of worship as well. That is going to scale it back down to about 10 people that'll be able to do that, simply because the numbers have been going up. So you're talking about now close to 4 million people who will now find themselves back into lockdown for the Toronto and Peel region of Ontario only. It does not affect the regions of Halton or York, at least not at this time. Dr. Ronald St. is joining me, former Director General of the Public Health Agency of Canada's Centre for Emergency Preparedness and Response. Dr. St. John, your reaction to this news, lockdown coming back for Toronto?
It's difficult. It's a difficult decision to make. Don't forget that the data we see today reflect people that got infected a week ago or longer, had to go through an incubation period, then had to maybe have some symptoms, then get tested, and then they get reported today. So we're looking at the past when we look at today's data, which now we can guess. Transmission is probably still increasing. But do you want to wait and see before you do something? That's the hard part. So I think the measures that are being proposed today are appropriate, given the way the data has been, the direction the data has been going in.
The other thing I'm curious about, and there's a couple of questions I've got for you, but one of the things I heard from one of the reporters there was the following. If the government has been saying for weeks now that the biggest problem, the biggest issue here are, community spread, where people are having, parties they shouldn't be having, they're having get-togethers, they're not obeying the rules, why go after retail stores, which at this point anyway do not seem to be, not a lot of evidence that they are sort of super spreader locations, Dr. St. John?
Well, the whole idea is obviously to reduce the number of contacts we have in any given day, because this virus, as we know, is passed from person to person, and you have to get close to somebody to catch it. You don't catch it from the other side of the city. So anywhere where people now gather, there's got to be a place where we have to restrict contacts. Now, the problem is in the individual home, we can't put a policeman in everybody's home to say you got too many contacts in here. And you can't, people can't say, well, I've got a contact here, but next door, I'll go next door, and that doesn't count. We have to trust people to follow the rules when it comes to households and parties and so forth. And we have to look broader to reduce the number of contacts, and unfortunately that touches retail areas and other places.
So effectively, are we saying that smaller retail stores, Dr. St. John, and some of these others, for example, restaurants that were allowed to have patios, now they won't be, that they are, effectively paying the price for people who have been reckless and irresponsible by having these, effectively illegal parties?
Oh, yeah, yes, but unfortunately, everybody's going to pay the price for that, for people who acted irresponsibly. You can catch COVID in a restaurant. It may not be an outbreak, but you might come in next to somebody who's asymptomatic and inadvertently infect you. You can catch it in the gym. There have been outbreaks in gyms. There have been some outbreaks in other places where people gather. So unfortunately, everybody's going to pay a price.
Do you worry about the public, Dr. St. John, reaching a breaking point here?
Obviously, we have to worry about fatigue, as was mentioned by the Premier. It's an important factor, and people need support. I think it's important that people reach out to their friends by Zoom or by whatever other means they have to communicate and stay in touch, but not face-to-face.
In terms of this lockdown spreading elsewhere, I know you're following closely what's happening, in York, and there's Halton, there's Hamilton, there's Ottawa, where you are as well. And, those areas could find themselves in lockdown too.
Yes, everybody's moved up a little notch from, green to yellow, yellow to orange, and then red into lockdown. And given the total of picture of the data across the province, that I think is an appropriate way to go at this point in time.
Yeah, Windsor, Essex going up to orange, Waterloo to red, and who knows what's going to happen in the regions of Durham and elsewhere to the east of Toronto as well. Bigger picture, and we didn't really get a precise timeline, but this kind of a lockdown, circuit breaker, whatever term you want to use for the biggest city in the country, how long do you think it's realistic to expect it to be in place?
Okay, that's a big challenge and a big question mark. Because it's hard to foresee how long it's going to take for these things to work. And by the way, they will work. They will work. They worked in other countries. They worked in other situations. These measures will work to restrain some of the transmission of the virus. But if you look at other examples in other countries, Australia, Melbourne and New South Wales had to go into a similar kind of a lockdown, even more intense than ours, because people were told they couldn't move from their homes. And it took 111 days to get things down to 0 cases. So it's going to take a while.
One other thing, too, and you heard Doug Ford say it, he said, despite what we're doing here and despite, these numbers, we're actually doing pretty well compared to other countries. That, too, Dr. St. John, might lead some people to say, well, how come they can do this in the U.S. and how come they can do that in Europe and we can't do this? And why are we now moving into a lockdown if we're being told that the Canadian model is actually a pretty good one?
The Canadian model is a pretty good one, but it's got some leaks arise. It's got some leaks around the corners here, some difficulties. And you don't want to let it go to the point where, and I'm going to say it, the United States, where the virus is totally out of control, totally out of control. And you have this horrible situation of 250,000 people dying in the United States. And you don't want to wait till it becomes like Belgium, where the hospitals are overwhelmed. And Belgium was actually sending patients to Germany because they had no room. You don't want to wait that long. So our model is a good one. If we tighten it up and get rid of the cracks, then it's going to work.
You, of course, back, in the day, were involved in emergency preparedness. You know very much, how important it is to marshal the resources of, the federal government when it comes to this kind of thing. Do you think it's time for the federal government to be more aggressive in terms of leading this fight?
Well, actually, I do, in a sense. I think in Canada, health is a provincial responsibility, as we all know. But the federal government can exercise a great deal of leadership in order to sit down with the province and say, let's get a common base. Common base is everybody wear a mask. Everybody keep their social distancing. Now, somebody might say, well, what about limiting people's movement or travel? And so, well, that becomes much more of a local thing because the transmission of the virus is different across the country. So you got to leadership would lead to a common base all across the country, and then local needs would dictate local measures.
Yeah, we're just going to show the map when we can of where things stand today, Dr. St. John, across the country. And, again, these numbers, which continue to go upward, or really this persistence in Ontario and Quebec, those numbers, they're not jumping up, but they're certainly not going down. Manitoba is a concern, Alberta, BC as well. Do you think that what we're seeing in Toronto now might be mirrored in other major urban centers? Primarily, for example, Montreal comes to mind.
Yes. Also, Winnipeg comes to mind as well. The presentation made by Dr. Tam this morning, I've looked at the charts and looked at the curves, and yeah, there's some of the provinces where the rate per 100,000 population is even steeper than Ontario, and Manitoba is taking some aggressive measures in response to that, and BC as well is also becoming more aggressive. So all across the country, we need to look very hard at the situation today. Not wait for a couple of weeks. Say, did it really get any better? No, it's time to be very aggressive in curtailing the transmission of this virus.
Hey, Dr. St. John, appreciate you giving us an extended chat today as we follow this story. Thank you for your time, and I like your Christmas tree, by the way.
Thanks very much.